Here are your pre-op guidelines for surgery, which will be broken up into 3 sections. We will be splitting up what to do into these 3 timelines: 2 weeks before surgery, 24 hours before surgery, and the morning of surgery. We will start with 2 weeks before surgery. Make sure your pre-op labs are complete. Make sure your pre-op and post-op medications are picked up so they are ready for you once you are done with the surgery. And remember to schedule 2-week and 6-week post-op appointments 2 weeks before surgery. And these can either be scheduled with the surgeon or the nurse practitioner. Here are some medications to pay attention to 2 weeks before surgery. If you're on blood thinner such as Eliquis, make sure your doctor is aware and they can give you recommendations on when to stop it. You can continue to use acid reflux meds as needed. You can continue to use Tylenol as needed for pain. And then you also want to start the antibiotic metronidazole 500 milligrams 2 times daily starting from 10 days before the surgery. You will discontinue the following medications: stop taking aspirin and other anti-inflammatory meds, stop weight loss/diabetic medications. Some examples are GLP-1 agonists like Ozempic or Mounjaro. Stop sodium glucose cotransporters 3 or SGLT2 inhibitors like Jardiance. Stop diabetes medications that end with gliflozin in the ending. This list does not include all medications, so if you are taking a medication that is not listed and you are unsure whether or not to continue, go ahead and call the Anesthesia Pre-Op Assessment Clinic at 409-772-6579. Here are some guidelines to start 2 weeks before the surgery. Increase movement unless told otherwise. You can try to walk 20 to 30 minutes a few days a week. Eat healthy foods and drink plenty of water to help your body heal faster. Do try to reduce the amount of caffeine and alcohol before surgery to avoid dehydration. Avoid tobacco products to decrease surgical complications. Some procedures require you to stop smoking, so have a conversation with your surgeon if you do smoke. If you have a pacemaker, make sure it has been interrogated within the last 12 months, or if you have an implantable cardioverter defibrillator, make sure it has been interrogated within the last 6 months. Now we will move on to the day before surgery day. Now starting off with the do's. Start washing your body with antibacterial body wash and focus on cleaning your belly button, groins, buttocks, folds of skin, etc., as you can see in the picture. And then continue drinking normal, dilute, clear, lime-flavored Gatorade or water until 4 hours before your arrival to the hospital. Remember to make sure they are not one of the sugar-free ones because we want to make sure you have some energy. Please check in with your doctor if you're diabetic, as the recommendations may be different. Take your routine medications unless you were instructed not to do so. Apply the scopolamine patch or the anti-nausea patch behind the ear before going to bed, unless there is some known reaction to the patch. You can also use it for nausea when recovering from anesthesia, unless previously stated. These are medications to stop the night before surgery. Stop your normal dose of long-acting insulin. Take only half the dose the night before surgery if you do take insulin. Stop high blood pressure medications called ACE inhibitors or ARBs, ARBS. Stop recreational drugs, alcohol, and tobacco. Additionally, don't shave the night before because it can increase your risk of infection. Stop eating solid food after midnight, but remember to continue drinking dilute, clear lime Gatorade or water until 4 hours before your surgery. Now we have finally made it to the morning of the surgery. Here are some tasks to complete the morning of the surgery to make the process go as smooth as possible. The morning of the surgery, you will wash yourself again with the antibacterial body wash and again focus on the belly button, groin, buttocks, folds of the skin, as you can see again in the picture. Continue to take your normal morning medications with sips of water up until 4 hours before surgery, unless instructed otherwise. Remember to continue drinking dilute, clear lime Gatorade or water until 4 hours before your surgery. Now, in terms of packing for your procedure, here are a couple of items you should bring with you to the facility. Remember to pack any glasses, hearing aids, or dental cases. If you're being admitted, bring comfort items with you like house shoes or a toothbrush. Remove any jewelry, including body piercings. Wear pads instead of tampons if you're menstruating. Wear comfortable clothing that you don't mind getting contaminated. If possible, do not wear super long fake eyelashes or eyelash extensions. And if possible, avoid having super long fingernails because they can make monitoring your oxygen level during surgery difficult. Brush your teeth, but do not swallow the water. Wear glasses instead of contacts, and the glasses will be placed with your clothes when you go for surgery. And please notify your surgeon and anesthesia team at 409-772-6579 if there are any changes in your health. Examples would be an upper respiratory infection or flu-like symptoms within the past 2 weeks, any recent ER visits, a recent flu or COVID infection, or hospitalizations because a recent respiratory infection could negatively impact your recovery from surgery. So please let us know if you have any of the listed symptoms. Any new injuries or cuts near the surgical site must be reported because they can increase your chances for infection. Now we have reached the end of our journey together, and if you have any questions, please contact your surgeon's office. The Galveston campus can be contacted at 409-772-9507. The Webster, Clear Lake, or Leak City campus can be contacted at 832-632-5088. We are thankful to be able to assist you with your hysterectomy. If you have any questions or concerns, please reach out to your surgeon's office.